Hello YouTubers, welcome to my channel, Lady Nephrology, where we talk all things nephrology. My name is Kendra Morris. I am a board certified family nurse practitioner with more than 20 years of nursing experience. Most of my experience has been in nephrology, dealing with chronic kidney disease patients, end-stage renal disease patients, and also kidney transplant. And this channel is just basically an education, just speaking specifically to women about that are dealing with chronic kidney disease, end-stage renal disease, or have a kidney transplant. Because I've dealt with a lot of women throughout the years and on dialysis, and it's very near and dear to my heart. Dedicating this channel to my cousin Shakoya, rest in peace. June Trotter, rest in peace to her. Also Tonella and my cousin Brella. So today's topic, we're going to be talking about mineral bone disease in kidney disease. So what is mineral and bone disease? So mineral bone disease, which we also call MBD, related to chronic kidney disease, it happens when there is an imbalance in your blood levels of calcium, vitamin D, the parathyroid hormone, which we call PTH, and phosphorus. So what causes mineral bone disease in CKD? Well, when too much kidney function is lost, your kidneys, it can no longer filter out the excess phosphorus and remove it from the body in the urine. So in kidney failure, the phosphorus tends to accumulate and levels rise in the blood. So you will have a high phosphorus level. And that means calcium tends to be low and then your phosphorus goes high. And there are 4 small glands in your neck, which are called the parathyroid glands, and they release a hormone known as the parathyroid hormone, which is PTH. And what the PTH does, it draws calcium from your bones. So it takes the calcium from your bones and then to raise the blood calcium levels. So it takes it from the bones to raise the blood calcium levels. And with they remove the calcium from the bones, it causes the bones to weaken. And some calcium may also end up in the heart and blood vessels. And this may cause or worsen any type of heart disease. So what are some of the signs and symptoms of mineral bone disease? So some of the signs and symptoms, and a lot of times in the early part of the disease process, you really won't have any signs and symptoms. So once the kidney function starts to decline, you may start having some itchy skin, bone pain, weak bones, blocked blood vessels, heart problems, anemia, and nerve problems. So those are some of the symptoms that can occur with mineral bone disease. So how do we diagnose the mineral bone disease and chronic kidney disease? Well, first we do blood tests. So we check your blood work to check for your levels of calcium, phosphorus, vitamin D, and PTH, which is the parathyroid hormone. We also can diagnose mineral bone disease by doing a bone biopsy, an x-ray of your abdomen, and also an echocardiogram. Because sometimes, like I said, the mineral bone disease can affect your heart and blood vessels. So what is the treatment in mineral bone disease? So the treatment in mineral bone disease, we like to first start out by reducing the dietary intake of phosphorus. So we try to educate our patients to avoid high phosphorus food or to go on a low phosphorus diet. So some of the high phosphorus foods are nuts, milk products, dairy products, Coca-Cola, and also beans. They are high in phosphorus. So we tell our patients, and we have them work with a dietitian to avoid a lot of those high phosphorus foods. So we try to do a dietary first. And then usually a lot of our patients who end up in end-stage renal disease on dialysis, we'll put them on a phosphorus binder that they take with their meals. Some of the examples of phosphorus binders are Rivella, Renagel, calcium acetate, Velphoro, and Orixia. Those are some of the different phosphorus binders that we prescribe to our patients to help reduce the phosphorus levels in their blood. And so what they do, you take it with your meals and it binds the phosphorus, and then the extra phosphorus is eliminated through your stool. So that's how it eliminates the phosphorus. And then we also can put patients on vitamin D, such as calcitrol or Zemplar. We also use calcimimetics, such as Sensipar, and they help lower the PTH levels, and it also lower calcium levels. So we really have to monitor the blood work frequently to make sure the calcium levels aren't getting too low on the Sensipar. And calcium supplements, a lot of our patients take Tums. If they're not able to take binders, they take the Tums with meals, especially if they have low calcium levels, and that can help bind that phosphorus as well. And then surgery, that's one of the last resorts that we like to do for our patients, and basically a parathyroidectomy. So the PTH cannot be controlled. They remove the parathyroid glands, and they remove them surgically to help lower that PTH level. And then last but not least, exercise. So exercise, especially strength training, weight bearing exercises really help because your bones were weakened, so it really helps strengthen the bones. So I just kind of went over, what mineral bone disease is, what it's caused by, some of the signs and symptoms, how to diagnose, and also the treatment options. So that was a short snippet of this week's lesson on mineral bone disease and CKD. If you know any women out there dealing with chronic kidney disease on dialysis, have a transplant, please refer them to channel Lady Nephrology, where we talk all things nephrology, and every week we'll have a different topic. So please like, subscribe, and thank you so much for watching. Have a good day.